Welcome to Live with Hillsdale Hospital. Today is Friday, June 5th, and we are happy to keep you, our patients, our families, our neighbors, and our friends in the know and up to date about healthcare in Hillsdale County and the latest news in our community. I'm Kirsten Newland, Director of Communications and Development. I'm here with my co-host, JJ Hodshire, President and CEO.
It's great to be back in the studio again.
Absolutely.
And we have an exciting day today.
We have a guest.
We do.
If you haven't noticed.
Absolutely. And someone who doesn't even need an introduction.
Absolutely.
Because after we posted that we had brought her onto the team, Hillsdale, the place blew up.
Yeah.
Text messages, calls, all of that great marketing that was done by you in advance. But it is exciting to have you in the studio today. Obviously, Ashley LoPresto, a name well known to our community, physician's assistant.
Yep.
And I'm most interested in your journey because you're a local gal,
Yes.
having been raised, I think, in Pittsford area,
Yep.
right?
Yep.
Pittsford schools, I would
Yes.
assume, right?
Yep.
So I want to learn a little bit more and let our audience learn a little bit more about your background,
Yeah.
because it's important that people that are, our care providers, if we know them, we see them in church, we see them, in the restaurants, but there's a connection there,
Yeah.
right?
Yep.
And so welcome, first of all, for
Thank
your
you.
first time.
Yes.
Welcome to Hillsdale Hospital.
Yes.
As a member of our team, we're very excited. We're going to talk about where you're going in just a minute. But for our listeners who may not know you, why don't you tell us a little bit about your background?
Okay.
What got you involved in healthcare, and tell us your journey.
Yeah. So I was born and raised in Hillsdale County, grew up in Pittsford, married my high school sweetheart. He went to Pittsford as well.
Nice.
So yeah. And then I went off to college and I was doing, medical stuff. My dad was ill when I was in high school, and that's kind of what prompted me.
Okay.
Physician assistant.
Very
So
clear
I
for
was
many
his
years.
medical assistant for a little while, and he kind of propelled me into the PA profession, and I loved it. So I was his medical assistant. I went off to PA school for 2.5 years, came back and did some rotations with him. I ended up in Coldwater in the emergency department for a couple years.
Were you a tech? What'd you do there?
No, after
You
PA
actually
school.
after that.
Yep,
Okay.
after PA
So
school.
MA, go get your PA.
Yep.
Boom, go back to the ER
Yep.
in Coldwater. Okay.
Yep. And then my husband and I said, I think we need to slow down. We want to start a family.
Yeah.
So primary care was a better fit for us, a regular
Yeah.
schedule.
Yeah.
So I called up Andy and he was like, come on back.
Oh, wow.
So I was a PA with him for a couple years. I did transition over to Coldwater based on my husband's job. So I was in Coldwater for 4 years, actually.
Yeah.
Came back to Hillsdale because we moved back to raise our family here with our family locally.
Yeah.
And and then I ended up here.
Yeah. So talk a little bit about, so you were in college.
Yeah.
And did you know right off from the beginning that you wanted to get into healthcare?
Yes.
And was the catalyst because your dad was sick?
Yep.
So that's what really prompted you to do it.
Yep. I wanted to be a teacher.
Is that right?
Little. Yeah.
Yeah.
I wanted to be a teacher.
Yeah,
Yeah.
I can see it.
Yep. And I thoroughly enjoy having students.
Yeah.
So I do a lot of precepting.
Yeah.
Does that kind of play into being a primary care provider? Because
Yeah,
a lot of that
of course.
seems like it's patient education.
Mhm.
Yeah.
Wow.
Yep.
That's interesting.
Yeah.
Well, let's talk a little bit about just primary care in general.
Yeah.
So you've had the experience in the ER, the clinic setting, and recently had already been in Hillsdale, actually just across the street from the hospital,
Yep.
In a clinic working for Dr. Hartman.
Yep.
He's our orthopedic surgeon, the orthopedic
Yes.
surgeon all around. And, that's how I was introduced to you a second time. I met you with Andy,
Yeah.
but then Dr. Hartman said, I've got someone really good. And he explained some of the work that you've done to build their practice. And his wife, Dr. Shen, certainly speaks highly of you. And so really just had an opportunity to learn about your clinical acumen.
Mhm.
And I want you to share that with our listeners today, because you could have stayed in the ER.
Yeah.
You could have certainly went to a big hospital and got lost in the system, but you chose to come back and deliver healthcare services in primary care in rural communities. Outside of just the fact that you grew up in Pittsford and it's rural, is that your passion? Talk to us about your passion. Why primary care and what is it? Just explain primary care.
Yeah, so actually I was having a conversation with Lindsay earlier. I was given this analogy that primary care is like the hub of a wheel.
Mhm.
So primary care, our job is, prevention. So we're looking on how to prevent chronic diseases, treatment when it's necessary,
Yeah.
but being a resource for people. So if we do find that there's an issue that we can't deal with specifically as primary care, we need to do a referral. So we do a referral to a specialist, and those are the spokes of the wheel. So we're the hub, they're the spokes.
Yeah.
So everything kind of funnels back to us.
Sure.
So it's extremely important that patients have primary care because there are EMRs that don't communicate.
It's true.
There are insurance issues. And so it's really important that patients establish with a primary care and continue to see us so that we can continue to facilitate the best care for them.
Absolutely.
The reason that I wanted to be here, though, is because I think growing up in a rural community, you understand the nuances of it.
Very
Because there are so many people that come in that they're like, well, this is like backwoods wilderness medicine.
Yeah. No, it is. Yeah,
And
we
I
hear that
said-
often.
Yes.
Yeah.
And I said, but
That's rural medicine.
this
today.
is what it
It's
is.
rural medicine.
How does that affect the way that you guide patients through
Yeah.
their journey,
Yeah.
with screenings and with specialties? How does that impact it?
Yeah, so just open communication and just saying, listen, these are the resources we have locally. This is what we're going to do locally.
Yeah.
If we don't have that resource, we will get that for you. Thankfully, at Hillsdale Hospital, we brought in so many
There's quite a few.
specialists, new screenings, things like that. So I'm so grateful for that. And I keep telling people, we have this new provider, we have this, we have that. Dr. Alam, he's probably like, oh, another referral from Ashley.
He appreciates it.
So-
Dr. Logan, he appreciates it.
Yeah.
Yeah, everybody,
Yep,
you know,
I have-
urology, we appreciate all of that.
So I'm just so grateful to have those resources because, even just a few years ago, we didn't.
Yeah.
And they would have to be sent out. And unfortunately, in the rural community, we have to really look at transportation issues,
It's critical.
cost,
Yeah.
weather.
Yeah.
There are certain things that people have to travel
Yeah.
for procedures.
Yeah.
If it's in the middle of winter, that
Right.
really puts us in
It
that
does.
spot.
It does. What do you
So-
see as a barrier today? Let's just say in your patient catchment,
Mhm.
what's a barrier to care? I mean, you talked about transportation, but
Mhm.
what are you seeing?
But even knowledge.
Yeah.
Just the knowledge of
Yeah.
what we have. So I mean,
Yeah.
you guys have done a great job with advertising and really putting out
Yeah.
the things that we have because so many people just don't know.
They don't.
And so they just don't
Yeah.
have access.
Yeah. Access is a concern.
Yeah.
Obviously, you'd mentioned transportation as a
Mhm.
barrier. It remains one of the top
Yeah.
barriers that we find on our community needs assessment.
Yes.
Is just the lack of public transportation to
Mhm.
get to obviously the care providers.
Yeah.
But can you talk a little bit about what you're seeing right now in terms of what season are we in right now for healthcare?
Poison ivy.
Oh, no.
Poison ivy season.
Poison ivy.
So yeah, we're
Yeah.
seeing lots of rashes and things like that. But right now is actually a really good time to get kids in for their well child exams if you
Yes.
haven't, because they
Yeah.
don't have to miss
Over the
school.
summer.
Yeah.
Sports physicals, get those going so they're ready for school.
Yeah.
So we're not trying to jam them in. But right now it's sports injuries,
Right.
rashes,
Right.
summertime things.
What do
Yeah.
you wish every patient or every family knew about prevention for poison ivy and sports injuries and things like that?
Well, so for poison ivy, it's going to be mostly just being able to identify the plant.
Yeah.
We live
Mhm.
in
We do.
the country.
Yeah,
absolutely.
So
Yeah.
just trying to identify the plant,
Absolutely.
but also just making sure that when you come in, you're washing everything in hot water with
Yeah.
soap. And it doesn't necessarily spread person to person.
Right.
It's the oils
Right.
that are there. So if you wear your garden boots outside, you get poison ivy,
Yeah.
you go put your garden boots back on,
Guess what?
it's going to go
It's
back.
going to come back.
Yeah.
It's going to come back.
So something like that. Sports injuries specifically, it's just making sure that we are preparing kids,
Mhm.
Adolescents, making sure
Mhm.
they're stretching appropriately, making sure that if they are doing a single sport, that we're
Mhm.
working on other muscle groups, because that's what we
Mm.
see with single sport, like people that really focus on single sports.
Mhm.
We see very specific injuries to those
Right.
athletes.
Right.
And it's extremely important that if they're going to specialize in the sport,
Mhm.
that we also work other muscle groups to prevent injuries
Yeah.
specifically related to that
Yeah.
sport.
So, do you have a niche that you enjoy more in medicine than others? I mean, some people say, well, I like, dealing with pediatrics, or I like dealing with geriatrics, or I
Yeah.
like, dealing more with a specific
Yeah.
chronic illness. What do you like?
So I really like nutrition and exercise, like physical activity. So any of my patients can tell you when they come, that's our conversation. I mean,
Is it?
go ask Denise how many referrals she
Yeah.
gets. So
That's great though, because that seems to really impact every other facet of health.
yes, yeah. So
in
that's
some capacity.
one of the biggest things that I am a huge proponent
Yeah.
of, and I will sit down and I will talk about meal planning.
Right.
I will talk about meal prepping. I
Yeah.
will talk about.
It's hard though, isn't it?
It is,
I mean-
but there are so many things that, if you sit down and just make it digestible
Yeah.
to patients,
Yeah.
where I say, you know what,
No pun
take
intended.
No pun
Ta-
intended.
right, exactly, right. But take an hour on a Sunday and make breakfast burritos for the week. So then you're not grabbing,
Yeah.
something that's full of sugar and,
Mhm.
Yeah.
not great carbohydrates right in the morning. You have protein, you have a good carb, you have all of those things. And it makes it easier in the long run
Yeah.
to make
Mhm.
good, healthy choices.
But a lot of barriers though.
Yeah.
I mean, to that even.
Yeah.
I mean, it's the economy that we're in today.
Mhm.
Yeah.
The cost,
Yep.
obviously inflation is playing a critical role in
Yep.
people's ability to buy fresh fruits even.
Yep.
We hear that all the time.
Yep.
It's costly.
It is.
And so what alternatives do people have that cannot afford access to good food,
Yeah.
healthy food? Because that's a problem we face in this community.
It is. It
what,
is.
What do you say to that group of people who are telling you, yeah, you know what, Ashley, I'd love to do that,
Mhm.
but have you looked at the local produce counter and what the cost is?
Yeah.
What do you give in response to things like that?
Yeah. So, like for instance, at our church, everybody brings stuff
That's
from their
true.
garden.
Yeah. Yeah.
So there, we have some people that are really great
Yeah.
at growing lettuce,
That's
and
true.
some people that are great at
Yeah.
growing green beans.
So there's access.
So there
You
is,
may
and
have to
if,
look for it.
but if somebody has a question about that, I would be more than happy
Yeah.
to direct them or try
Yeah.
to offer some sort of support for that.
Yeah.
You can get involved with like co-op shares,
Right.
things like that. If
Right.
you don't have somebody that
That's
has
true.
access to that. My friend and I, she's going to be having a baby, so I'm so excited. But we are getting together. We're doing freezer meals together.
Okay.
So then we're going to have stuff for the summer because I'm transitioning to a new job.
Yes. Yes.
She's
You're
going
gonna be very busy.
she's going to be having a baby. So we
Yeah.
just talked yesterday. I said, all right, let's get some recipes together.
Right.
And our kids play and
Yeah.
we meal prep.
Wow.
Yeah, that's very
You know,
powerful
so,
because
yeah.
we so often talk about the barriers of rural
We do,
communities
we
and
do.
the lack of resources. But
Yeah.
there's a different kind of community and coming
Mhm.
together
There
over
is.
things like that
Yeah.
that
Yep.
really provides a kind of access. And it's difficult to get if you're not in that rural community.
It is.
And I don't want to, you'll always correct me, but I
Totally.
think it was at least 40,000 we gave to local food pantries last year.
Yeah.
$40,000. And that was to support, fruits and vegetables and
Mhm.
healthy foods.
Yep.
One of the passions I had early on with Denise Lovinger when I started my role as operations and I worked very closely with Denise, is to educate even our food pantries at the time, because we were giving away, sweet cereals
Yes.
and Pop-Tarts and
Yep.
really not the most nutritional. Now we've shifted in
Yes.
this county
Yep.
to more of, all right, what's wholesome, can we
Mhm.
get those garden foods in? But I think as you look at this season that we're in right now, it is the fruits and vegetable season.
Yep.
So
Mhm.
to your point, there is access.
Yeah.
Community, food banks, those are available. I think we have partnerships with quite
We
a few of
do,
them.
and that's all on our website, so
Okay.
patients can see hours and details and
Yeah.
how to access those things. And a lot of those food pantries will really guide people
They do.
through, what ingredients can I pick off these shelves
Yeah.
that will help me
Yeah.
actually have a recipe instead
Yeah.
of random ingredients.
Right.
So there's resources, and,
Yeah.
and they want to help. That's what they're there for.
And sadly, what we find is, the meal deal at McDonald's is cheap.
It is. Yeah.
And so you have to fight that.
Mhm.
And that is not healthy.
Right.
And Denise will often share, and as she did with me, she's like, it's not that you can't eat that at times.
Right.
It's like,
But that
it's
just
what are
can't
you
be a
eating?
staple.
It just can't be
Yeah.
your main staple, right? There has to be some balance there.
Yep.
So obviously working closely as you do with Denise
Yeah.
and dietary and those things. We also have access to a lot of specialty care here.
Mhm.
And so who do you normally work with for specialty care? You're referring to?
I mean, it depends on the patient.
Yeah.
So, I mean, I'm referring to the OBs,
Yep.
for certain procedures that
Right.
I can't do as primary
Right.
care. Like I said, Dr. Alam sees my patients a lot.
Vascular.
Yeah. Dr. Loganathan. So,
Yeah.
I have him, our pain clinic. So people that aren't necessarily a surgical patient,
Yeah.
that I'm saying, listen, Dr. Loganathan
Yeah.
might need to see you in the future,
That's right.
but let's get you into the pain clinic for now. They can see you, they can get you treated,
Yeah.
and then move forward if we need
Absolutely.
to.
Absolutely.
Orthopedics,
Yeah.
neurology. So
Yeah.
we have that, podiatry.
Right. Right.
Also, general surgery, they see my name all the time because we're trying
They
to get
do.
colonoscopy
They do,
screenings.
yeah,
We're
yeah.
trying to get
Your
all
name comes
those
across
things.
quite a bit. Yeah.
Yeah. So
Wow.
I feel like we have so many
Yeah.
resources that
Good.
Yep.
Your patient will have access locally.
Of course.
Yeah.
Yep.
What's the benefit of having so many, specialties, but also because we're a smaller community and you've been working in this community, you kind of know all the providers. You're all connected. How
Yeah.
does that benefit the patient?
Oh, I think it benefits them tremendously because
Yeah.
especially if I have somebody who I'm like, this is urgent.
Yeah.
I can call that provider and
Text them
say,
even.
Yeah.
I'm serious.
a
I
great
can say,
relationship.
you know what?
Yeah.
This needs attention now. And they're like, okay, Ashley, let's figure it out.
Yeah.
Instead of, and I can say, and I tell the patients, I'm like, this needs to be seen by a specialist.
Yeah.
If you can't get in for 1 or 2 weeks, it's okay.
Right.
We're going to manage your symptoms in the meantime.
Right.
Or I'll tell a patient, this needs to be done now.
Yeah.
And I'm going to get on the phone with them and we're going to get this going.
Absolutely.
So that's what's nice is because they also trust my judgment that I'm not going to call them with every single little thing,
Absolutely.
But yeah, they're very great in responding and being helpful. So even if it's not, I need you to see them right now, it's, I have a question about this. Can you tell me what you think the best course of action would be?
Yeah.
So
it's exciting because your first day is actually
June 8th,
June 8th.
Yep.
Okay.
Wow.
So that's just
Monday.
Monday. Right around the corner.
If a patient
Wow.
calls though and wants an appointment with you, what would be
Yep.
the soonest day?
So June 22nd is when my schedule opens.
Okay.
However, I've heard that it's already
Is it
booking
booked?
out a
Is
little
it-
bit.
Wow.
So I
Of course.
yeah.
Not
Of course.
surprised.
Yeah.
So
Exactly.
so I can say that it probably wouldn't be a June 22nd appointment.
Right,
That's when
right,
I'm going to start.
Right. So make your calls now.
Yes.
Yeah.
We're taking appointments now.
Yes.
On a wait list.
Yeah. Yep. So.
And your location where you're going to
Yep.
be.
So I'm going to be at Hillsdale Medical Associates on Hudson Road.
Hudson Road,
Yes.
yeah.
So yep, I'll
The
be
old
with Brandon
yeah,
and Kathy and Dr.
yeah.
Baker and
What a great team out there.
yeah, I'm so excited. I got to go in and meet them all
Yeah,
and figure
yeah.
out where my office space
Yeah,
is.
we
So-
probably worked with most of them anyway throughout your career.
Yeah. Yep. I've had some sort of
Yeah.
interaction with all of them.
Yeah.
So
So Hillsdale Medical Associates, Monday through Friday for you.
Yep.
Okay.
Yeah.
And they can call the office and you have information on our screen that we can post.
Absolutely.
for the number?
Yep.
Okay.
Or just visit hillsdalehospital.com/primary care. Makes it pretty easy.
Well, we're excited that you're starting a new journey here
Yes.
with Hillsdale Hospital.
yes.
And the beauty of this is that your diverse background of the emergency
Mhm.
department, because you see everything there, right?
You do.
I mean, and you do everything
Yeah.
there, from stitching to you name it.
Oh yeah. Yeah. I still do that in primary
And
care.
you're still doing primary care because that's
Mhm.
the other point I wanted to raise is that it's kind of like all in when you're in primary
Yeah.
care and
Yeah.
rural medicine.
Yep.
It's not just one
Just
niche,
a
it's
catch-all.
all in.
Yep.
And so we're still doing that. And at the place you're going, we have a lab now.
Yes.
So the patient doesn't even have to leave your office, point of service right there.
Yep.
Doesn't have to go to Hillsdale Hospital, doesn't need to go to Three Meadows, right there, stop in, get your blood draws, and then it's one-stop shop.
Yeah.
And we
Yep.
find that to be very, very effective.
Yeah.
What are you most excited about in this
Uh,
journey?
I'm really excited to come back. And I'm really excited for my work-life balance with my family,
Yeah.
being able to be close
Yeah.
to my family. But also I feel like I have something to offer.
That's right.
And, I really feel like I can find my place here
Yeah.
and
Yeah.
really make a difference.
Yeah.
So
Let me ask you the tough question is, healthcare is rapidly changing
mhm.
across this country. And I want your perspective and from your lens, what keeps you up at night thinking about our industry and what's happening, whether it's just the pure politics of things or if it's the patient area, what keeps you up at night? What concerns you?
So what concerns me is access,
Yeah.
for a lot of patients, and whether that's physical access
Right.
because of transportation or
Right.
those barriers, or access because insurance
Insurance.
says no.
Right.
And I've had to do peer-to-peers, and
Yeah.
you have to say no. This is what needs to be done for this patient.
Exactly.
So
Yeah.
we got to figure it out.
Yeah.
And it's really, really frustrating
Right.
because I feel like a lot of providers aren't able to actually provide medical knowledge and treatment
Yeah.
how we're supposed to because
Right.
insurance says, well, you have to follow
Exactly.
this algorithm.
Oh yeah.
Yeah.
Oh yeah. Listen, we live that every day.
Oh, yeah.
Right?
And it's so hard because
Yeah.
with the best intention that I have, patients still don't receive the care that they
I
need,
agree.
or they get upset with us. And
They
and
get
I-
upset.
and I
They think it's
understand.
us. I understand.
And I totally understand, and I try to sympathize, and I say, I am working my hardest.
Yep. But it's a bureaucracy of what we have to
Yeah,
deal
there's red tape that I'm cutting every
Yeah.
day.
Yeah.
with. Do you find that the country's changed since COVID? There's a lot of conversation about vaccinations. And
Mhm.
are those conversations becoming harder for you?
I feel like I'm pretty open,
Good.
and I talk to patients, and I see a lot of kids.
Yeah.
So we're talking to parents,
Right.
you know, and
Right.
some people are doing alternative schedules, and we talk about what that looks like,
Right.
and we talk about what's necessary, and
For the wellness of the
yeah,
child.
yeah. So so it's an open conversation. I don't want anybody to ever think that,
Right.
you know, I'm going to go to her and I'm just, you know, going to feel preached at
One way or
look-
the other.
Yeah. I am totally open, and I want what's best for my patients, and we'll have a
Right.
discussion. And if I really think that this is best, then I'm going to
Then
be
you're
open and
gonna-
honest.
Oh, absolutely.
And all my patients know that.
Yeah. I think everybody knows that. Yeah.
So, but I'm willing to have those conversations.
Yeah.
So,
Good.
Well, based on the conversations we're already having in our community, I know that our patients already know that you're an advocate for them, you're a champion for them, and you really support every facet of their well-being.
Yeah.
So we're really excited
Yeah.
to have you here.
Kirsten, I'm excited because I firmly believe, and I've been here 16 years, we now have one of the best teams in primary care that
Absolutely.
we've ever had.
It's solid.
You know, Dr. Muse is our medical
She's
director,
fantastic, yes.
and all the way,
Yep.
you know, from every level. We have incredible team members, and the
Two
providers.
walk-ins.
Yeah, I mean, 2 walk-in clinics, and you know, service labs, and but just the providers and the level of providers who are community based.
Yeah.
You know, I mean, and I don't want to leave anybody out, so I often get in trouble if I name them. But you know, I mean, you can go see Rihanna, and she can take care of not only just your needs from a medical perspective, but also she's dealing with psych issues
Yeah.
and behavioral health issues.
Yep. And I've made referrals to
Absolutely.
her from a psychiatric
Yeah.
standpoint.
How amazing, though, in a rural
Mhm.
community hospital that we would have someone that diverse in care delivery.
Yep.
I mean, that's incredible to
It
have
is.
that. And then you think about, you know, Brandon's been, you know, in this community forever as
Yep.
well. And just his scope of practice and your scope of practice, and seeing all that come to fruition with
Yeah.
our team, it's incredible to
Yeah.
see the team come together. And I'm not leaving anybody out.
Yeah.
But I'm just giving those as example, niche type, what you normally see in bigger systems.
Yep.
We have diversity here for all types of medical health services.
Yep.
And so that's exciting. One of the best teams that I have ever worked with in my 16 years.
Yeah.
Very excited to see what this is going to bring for us and for you.
Yeah.
Hopefully a good work-life balance
Yes,
for you.
yep.
I think call is like 1 in 17 now or something.
I know
crazy.
that's what they said.
Yeah,
We have so
it's-
many to provide.
There's so many.
Yeah.
Yeah, you know, you're not on call every day or
Yep.
anything of that nature. And you have great mentors.
Yes.
Andy Scholl,
Yeah.
a great friend of mine, is, you know, mentored you and I think convinced you maybe to even go to PA school.
Yeah,
Or
well,
at
I
least
mean, I kind of
influence
was already
you.
on that track,
Yeah.
but he did mock
Influence you.
interviews with me.
Yeah.
He sat down, went over, you
Yeah.
know, all my paperwork. So, and I
Yeah.
really owe
Yeah.
who I am as a provider
To him, yeah.
Mhm.
And then certainly the influence of great people like, you know, Dr. Hartman and his
Yeah,
wife,
Dr. Chen.
Chen.
Yep.
Dr. Chen, I mean, I'm afraid of her a little bit, but at the end of the day, I mean, she's incredible.
Yes.
And
yep.
no nonsense type person, but is, you know, great for her patients. And
Yeah.
Dr. Hartman's such a gentleman,
He is.
a
Yep.
great man
Yeah.
that just understands business
Yes.
very, very well,
Yeah.
but has nurtured you
Yeah.
to a certain level and mentored, even though he's not primary care.
Right.
You know, he's a provider who's been
Yeah.
invested in our community.
Right.
And so all of that brings a well-rounded, you know, provider to our community. So
Yeah.
welcome.
Thank
It's
you.
exciting. Your journey will begin on Monday.
Yes.
We'll put the number up on the screen if you want to make an appointment. Certainly we'll get you in. Probably it's not going to be June 9th, but it will be sometime in probably July.
Yeah.
that we'll
Yeah.
get you in.
It'll be
But-
quick. It'll be
but
quick.
it'll be quick.
Yeah.
But certainly opportunities.
Yes, of
And
course.
each of our clinics have walk-in opportunities as well. Let's not lose sight of that. So if there's an urgent or emergent need, we do like to have appointments available. And so we make that commitment
Yes,
to our
and-
community as well.
Hillsdale Health and Wellness and Reading Health Clinic as well. You can
Yeah.
go see Jennifer Blonde out at Reading. So both
right.
of those are walk-in clinics, or same day if you want to call ahead,
Yeah.
or you could call one of them and ask if they're busy or where they would recommend
Yeah.
going. for the
In
fastest
reading,
visit.
that is done very well.
It has
I mean, she
Wonderful
is.
response.
Yeah, I mean, she's done an incredible job at getting the
Yes.
patient through, quadrupling our patient volume in
Yeah.
reading, and she's just
That
focused.
really
and
speaks to the need.
It does.
Too. And
It
it's
does. Access.
incredible.
we had
Right.
people telling me
Yeah.
we can't get in for months. It's
Yeah.
like, well, how is that
No,
possible?
yeah.
Mhm.
That should not ever happen
Yeah,
in primary
no.
care. You know, same day appointments
Yep.
are important, but even if you can't do same day appointments, you need to get in a timely manner. You
Exactly.
cannot wait.
Yeah.
And so that has all been streamlined now. Every one of our clinics is either walk-in ready or has a component of that,
Yeah.
and or we'll get you in ASAP. And that speaks volumes to the type of
Absolutely.
providers we have.
Yeah.
They're committed, they're dedicated, they're driving 180 miles an hour, because I'm telling you, you guys are workhorses.
Yeah.
And excited to have you part of the team.
Thank
So
you.
welcome. It's great to have you here.
Thank you very much.
Let's check in with Vanessa to see if we have any questions. No questions?
All right. So if they do have a question, though, they can submit one online, correct?
Absolutely. Just comment on the post and we'll get back to you right away. So thank you, Ashley.
Thank
We
you.
appreciate you being
Yes,
here. We
very
will
nice.
provide all of your information, and we'll also be on our Find a Doctor page on the website. You can go read a little bit more about Ashley and her background. And to close, we want to thank you, our community, for your continued support.
Yes.
If you would like to connect with us more, visit hillsdalehospital.com/live. There you can nominate a hospital staff member for our patient care award, including Ashley. Support our mission by donating to the hospital.
Or Kirsten.
No. Patient care award.
Oh, okay. All right.
Learn about volunteering and consider joining an award-winning workplace in the healthcare industry. Catch us on WCSR 92.1 on Fridays and Buzz Online 102.5 on Saturdays for our radio updates. You'll hear Ashley's interview today on Friday and tomorrow and Saturday as well. And don't forget to check out our national podcast, Rural Health Today, at ruralhealthtoday.com, or you can subscribe to it wherever you get your podcast. Until next time, stay safe, stay healthy, and remember, rural